Good morning and Assalamu alaikum, ladies and gentlemen, and dear parents. Today we are going to talk about a topic which is very common in children, and generally parents are very worried about it, and that is constipation. Chronic constipation. That means constipation which is long standing. The child initially starts with constipation, 2 days duration. That is, the child does not pass any stools for 2 days. Then as time passes, it becomes like 4 days, then nearly 5 or 6 days. And when the mother consults the doctor, it is when the child is in a state where the child does not pass stool for nearly 4 or 5 days, and until and unless a suppository or enema is given, the child does not pass stool. Basically, the history is that the child tries to pass stool, but the stools are very hard, and the child cries when she or he wants to pass stool, goes to the washroom, tries to pass stool, cries, and then comes back. And this then sets up a cycle. Actually, it is all a matter of lifestyle, and it is all a matter of the diet you take. That is the diet the child takes. Over a period of time, in the past few years, I have realized that constipation is becoming more and more common in children. Generally, after 2 years or so, it becomes more common. I've seen children 6 years, 7 years with the same complaint. It's the diet, it's the lifestyle. Children who eat more rice, who eat more bread, who eat more junk food, pizza, burgers, french fries, cakes, cupcakes, pastries, chips, noodles. These are all the things that contribute to constipation, as there is less fiber, and since there is less fiber, the guts move less, and this leads to a vicious cycle. Children are consuming less and less fiber containing foods, less and less healthy foods, less and less foods which are nutritious in value, less fruits, less vegetables, and there is less physical activity. It's more time spent on the screen, on mobile phones, on the television, and it becomes a vicious cycle. This leads to a state of constipation, and as the stool becomes hard, if it's 2 days, the stool becomes hard. As the stool becomes more and more hard, the child has difficulty in passing stool. This leads to the formation of fissures. What I mean by fissures in the anal region is this leads to small cuts in the anal region. And when the child wants to pass stool, he or she has severe pain, and the child stops passing stool. She goes to the bathroom, tries to pass stool, has severe pain, and comes back again. This then leads to a further state of constipation, and a stage is reached when, unless and until you give an enema, it doesn't work out. The child is miserable, the child is crying all the time, there's a feeling of heaviness in the child, and the child does not even eat. And this has now become a very common problem because of our lifestyles. The doctor will help you with some medicines, but what you need to do is basically make some changes in the diet. You have to stop the child from eating white bread, fine flour, that is, not eat pizza, not eat cakes, not eat noodles. These are all flour, and flour has no fiber. It leads to further constipation. The child has to eat either brown bread, or the child has to eat, basically in Pakistan, India and the subcontinent and many other countries, you have roti or chapati, and the roti or the chapati should be made with the brown wheat flour, not the fine flour. And this is what the child should eat 3 times a day. I mean, no rice at all, no rice at all. More fruits, more vegetables, no fast foods. Another thing which helps, and this is at least for the 15-20 days, and then you can get the child back to normal till things become better. And one thing which helps is having khajur, 2 khajur a day, or figs, which we call anjeer, having 1 or 2 figs a day. Increase physical activity. This should be accompanied by medicines and the treatment prescribed by the doctor. And believe me, in a period of a month or so, this constipation gets over, and then the lifestyle change of the diet has to be adjusted accordingly. The child can have rice 3 or 4 times a week, but not 2 times. Sometimes the constipation is also related to the family history. Generally, the family has a history of constipation. However, it is a long topic, but these are the basics of it. Thank you very much.